Dr. Zhou. Today I want to talk about the key points about the treat principle of the lower extremity fractures. There are 6 parts. First is the hip fracture. There are 2 kinds of fractures, femoral neck fracture and the intertrochanteric femoral fracture. They are usually happen on the older patients. The femoral neck fracture is an intracapsular fracture, so the non-union and the femoral neck necrosis is a very common complication. The diagnosis is easy to make, depends on the X-ray. There are several classifications. First is classified by the location of the fracture line. The other is the Garden classification. It depends on whether it is complete fracture or displaced. The other is the pulse classification. The treatment is usually depends on the Garden classification. The Garden type 1 and 2 usually we choose the conservative treatment, and the type 3 and 4 need to operate. The operate, we usually use 2 methods. First is the screws, internal fixation, and second is the arthroplasty. The patients younger than 65 years old, we use the internal fixation. If the patient is older than 65 years old, usually we use the arthroplasty. This is the screw fixation. This is the arthroplasty. The second is the intertrochanteric femoral fracture. It is a little different from the femoral neck fracture. First is this is the extracapsular fracture. So the non-union and the malunion is rare. There are several classifications. The advanced classification and the AO classification. Usually, we use the AO classification to make the decision. You can see there are 2 subgroups. First is the stable group, and the second is the unstable group. We use dynamic hip screws to fix the stable group. And for the unstable fractures, usually we use the intramedullary nails. This is the intramedullary nails. The femoral shaft fracture, usually there are 2 implants. The first is the intramedullary nails, and the other is the plate. If the fracture is at the diaphyseal fracture, usually we prefer to use the intramedullary nails. This is the nail. First is the antegrade nail. The other is the retrograde nail. The third is the distal femoral fracture. The AO classification is a common classification here. You can see first is the partial articular fracture. The second is involve the diaphyseal. The third is the comminution fracture. Usually we use the plate to fix here, a locking plate. You can see the X-ray, the post-operative X-ray. We use a locking plate here. The fourth is the tibial plateau fracture. The common classification is the Sasker classification. It divides into 6 types. The type 1, 2, 3 is the lateral side fracture, and the type 4 is the medial side fracture, and the type 5 and 6 involves the both sides. Usually the type 1, 2, and 3, we use a plate at the lateral side, The type 4, we use the medial plate, and the type 5 and 6, usually we use 2 plates to fix the both sides. The tibial shaft fracture, it is the most common fracture of the long bone. And if the fracture is stable, we can use the non-operative treatment. If the fracture is unstable, we can choose the operative treatment. The treatment method, usually we use the nail. And if some patients is near the diaphyseal, we use the plates. The 6th is the ankle fracture. It is classified for monomoleolar, bimoleolar, and trimoleolar. The treatment time window is very important. The first treat time is the first 12 hours after injury, and the second time is the 2 or 3 weeks after the injury. The first is the medial moleolar fracture. Usually we use a screw 1 or 2 to fix the fragment. The lateral moleolar fractures, we can use the plate screws to fix it. It depends on the fragment, large or small. If bimoleolar fracture, it is unstable. Usually we need to fix it. The posterior moleolar fracture, if the fragment is larger than 30% of the articular, we need to fix it. This is the picture. We can use several screws to fix it. Oh, thank you for your attention.